Hey everybody, I'm Jeff. I work here at Active Spine and Joint Institute. I'm here with Tracey today. She's a patient. She's been coming in for a very long time now. She's been coming in with complaints with her elbow pain. She has tennis elbow. So recently we've been using this machine right here. This is our shock wave therapy. It's really good at breaking up any kind of scar tissue. Yeah, Tracey, it's one of her best friends, I think. But it's great at breaking up scar tissue, any kind of joint or tendon disorders going on. It's really good with that, and it's actually really popular with plantar fasciitis in our office. Tracey's been coming in working on her tennis elbow for a couple months now. Tracey, you want to talk about it?
Yeah, it's been about 3 months, and I had a lot of pain. I couldn't lift things or squeeze things, and so I would come in. At first, I think it was twice a week, consistently, and now I'm down to it was once a week, and now it's once every 2 weeks, and it just goes on, and it's just breaking up all that tough, tight scar tissue so that it loosens up, and slowly you can start doing things again, lifting things, squeezing things, but it takes time. Yep. So I'm almost there, and it's almost tennis season. So
that's as she said, she's a big tennis player, so we're trying to get her back in shape for tennis season. But she's well on her way to getting back on track, I'd say.
Yeah, I picked up my racket the other day, as a matter of fact, and started squeezing it. And you got to go easy. You have to ease into it. You just can't go out there and start playing 3 sets. But it's working. That's what matters. Getting it better, not masking it or doing something else, or living through the pain, just fixing it.
Right, exactly. So thank you, Tracey.
Thank
Hopefully
you.
we can get her back on the court
Soon.
very soon. Thank you.